Hello, everyone. I'm so grateful to be here to celebrate the first season of Salud. I'm joined by, yeah, it's like a dream come true for us. I'm joined by all of our supporters, the Boston Public Health Commission, Harvard Medical School, El Planeta, and GBH. And I want to tell you a little bit about the story behind this podcast. The idea came during the pandemic. I was working as a full-time reporter for El Planeta. And, we noticed that misinformation was a big problem in Spanish. It's always been, but it sort of became more visible, during the pandemic because there was this immediate need for reliable, information for the Latino community, one of the hardest hit. So, for example, I remember we found members of our Hispanic community in Chelsea or in Lawrence getting, wrong information about vaccines on Facebook or on WhatsApp groups. So, we came up with the idea of this podcast, and I applied for a grant with the International Center for Journalists to produce a pilot. And I got the grant, and I thought, well, I need to make this sustainable, so I need, partners. Here's the team we're here celebrating this. A little bit about myself. I'm an immigrant from Venezuela. I came here 9 years ago. And, being an immigrant, I think it's also being important for me to find those stories that I know are important and feature them so our audience, they can connect. Perhaps, one of the most exciting episodes for us to produce was our first episode about human longevity. It's a fascinating topic, and we learned that Latino women, Latinas, applause for Latina. we have the highest life expectancy of any group in the U.S. And if you want to know why, I invite you guys to listen to our first episode of Salud. We discovered that, while we were reporting for this episode, and we interviewed a very special character, a 94-year-old Cuban singer who just won the Latin Grammy for Best New Artist. Let's hear about her.
Vivir la vida a tu manera, ser dueño de tu edad. Ese parece ser justamente el secreto de la longevidad de Ángela Álvarez, una abuela cubana que a sus 95 años está cumpliendo el sueño de su vida, ser cantante. Y no solo eso.
Mejor nuevo artista. Ángela Álvarez
acaba de conseguir una nominación al Latin Grammy.
Con la esperanza de un nuevo día, las horas van pasando y yo siempre esperando un nuevo amanecer.
Cuando hablé con Ángela, me transmitió instantáneamente pura alegría y ganas de vivir.
Me siento muy feliz. Me siento como si tuviera 20 años.
Ángela comenzó a escribir canciones en Cuba cuando tenía 12 años.
Me gusta mucho la música desde niña. Desde niña siempre me gustó cantar. Para mí, la música es el lenguaje del alma.
Siempre quiso dedicarse a la música, pero su padre tenía una visión muy tradicional de la mujer y nunca se lo permitió. Cuando le confesó su deseo de ser cantante, esta fue su respuesta.
Ay, mija, tú, mi única hija, Yo no quisiera que tú hicieras eso de cantar al mundo. Tú puedes cantar para la familia, pero no me gustaría.
Por eso Ángela nunca cantó en público, pero sí continuó escribiendo sus canciones. De hecho, hoy conserva las letras de más de 40 canciones que canta acompañándose con la guitarra. Un día, uno de sus nietos, Carlos, comenzó a interesarse por ese pasado musical de su abuela. Él la había escuchado cantar toda la vida en reuniones familiares, pero nunca se había imaginado la historia que había detrás.
I began to get curious about her.
Comencé a sentir curiosidad, dice Carlos. Y un día le dije,
I'm gonna put a microphone in front of you and
abuela, voy a ponerte un micrófono enfrente y quiero que me cantes todas esas canciones que has escrito. Y me quedé boquiabierto, dice su nieto, porque lo que no sabía era que mi abuela era una artista frustrada.
Pedacito de patria, pedacito de cielo.
That's a clip from our first episode on human longevity. Thank you. So I'm joined here by our supporters, and I have a few questions for each of you. I want to start with Javier from El Planeta. Javier, I remember clearly when the pandemic hit, and we were getting all these messages from members of our Latino community on Facebook, on Instagram. They were desperate for information. They were asking, us everything. I'm sure you remember that moment. Tell us about the importance of the job that El Planeta did during those times, and why you came on board for this project.
Yep. And to answer your question, I will go first with one huge example that you have to digest and understand why, when there is a crisis and community media like ours is not in the right place with the right content, a big tragedy can happen. And I don't know if you know, but El Planeta Media also owns the largest, we own the largest Spanish newspaper in Washington, D.C. It's called El Tiempo Latino. It used to be owned by the Washington Post. When Bezos bought that paper, we acquired it. The day one when Donald Trump was inaugurated back in the elections of 2016, he was inaugurated January, I believe. The day one, he gave the order to erase all the Spanish information from the White House. So imagine the inauguration day, no Spanish information from the Washington White House. So guess what? My newspaper exploded. I remember receiving a phone call from a friend, Hispanic doctor. I won't say his name, and also the hospital is one of the top 3 hospitals in this city. And he called me, listen, there is a big problem with the community. The ICUs, as full of people of color, I would say about 40% of all the ICUs are Latinos. You have to go out and say this. And I said, can I say your name? And he said, no, because I'll be fired. I'm not allowed to tell you what I'm telling you. Can you find some other Hispanic doctors? And he did. So then the chief inclusion officer of MGH, Dr. Joe Betancourt, was brave enough to be convinced by Tibisay at the time she was their reporter an editor in El Planeta in Boston. And he was willing to be vocal and say it. And so if it wasn't for community media to transmit what the real problem was, all the ICUs were filled up with our audience, because the perspective and the language disparities is extremely important to tap. Political leadership told me, we are all the time on TV. Yes, but you are on cable TV. At that time, 40% of our Chelsea residents, Hispanics, didn't have cable, didn't have broadband cable. So they only relied on cell phones, etc. So that's why Hispanic media is extremely important, and I'm answering your question, trying to give us also a big message.
Thank you, Javier. I remember as soon as we had our pilot ready, we contacted Frinny at the Office of Diversity, Inclusion, and Community Partners at Harvard Medical School to, listen to the episode and try to, get some advice. We really wanted to make sure, we were providing top quality information to our audience, healthcare information. And she was super receptive. Thank you so much, Frinny. I wanted to ask you, what did you like the most about that first episode, and why did you decide to support us?
Yeah, thank you so much. It was an honor to receive that email, not only because the Office of Diversity, Inclusion, and Community Partnership, one of our mission is to ensure or advance health equity at the local and national level. But personally, as a pediatrician myself, I've seen the miscommunication you're talking about, and how day by day when I see patients, whether it's at Boston Children's, at Martha Elliott, in Jamaica Plain, the information that they're getting is not information I'm reading in the journals, medical journals. So our goal is to engage with the community and to provide them the information that they need. In your podcast, in a way, one of the first few podcasts, I must say, about health in Spanish, completely in Spanish, it aligned very well with the DICP office at the Harvard Medical School, and also personally with my goals as a pediatrician to care for patients, but also expand that impact that we can have as we're trying to achieve health equity.
Thank you so much, Frinny, for being with us in this project.
Oh, it's our pleasure. I enjoy the podcast. I listen to it on 89.7 every Saturday morning. I send it to people all the time.
Our main sponsor for this first season is the Boston Public Health Commission. Yes. And we have here Dr. Sarimer Sanchez. She's the medical director for infectious disease at the Boston Public Health Commission. Sarimer, I also want to ask you, why did you decide to join us and support us when we reached out?
Well, first of all, I just want to say personally and professionally on behalf of the Boston Public Health Commission, how excited I am to be here and see this podcast come to life. We know that Latinos have been so disproportionately affected by the COVID-19 pandemic. They've had nearly 3 times the amount of cases compared to white residents and 5 times the hospitalizations nationally. But the impact on Latinos long predates the COVID-19 pandemic, and we know that Latinos have been disproportionately impacted by other infectious diseases, right. HIV, influenza, and chronic diseases such as diabetes. We also know that there are many factors related to structural racism that really need to be addressed to effectively overcome these, access to food, access to housing. But as I look back to the onset of the COVID-19 pandemic, I look back on similar memories that you have all described. I really think about the language barriers that really set us up for inequities and really set us up for a lot of deaths in our Latino communities. Mm-hmm. There is a really limited amount of Spanish information out there, and just realizing how important what we were doing was, and despite our individual efforts, really needing more systemic solutions, such as the podcast that we are seeing today. And so, again, the Boston Public Health Commission and myself as a Spanish and Latina provider, we are really committed to multilingual, timely health education for our residents. And again, that's why it's so important. This podcast is so important. So thank you. Gracias.
Thank you so much. And then finally, we have here Lee Hill, Executive Editor for GBH News. Hi. GBH is airing the podcast every Saturday at 9:30 a.m. And is this the first time that GBH airs a Spanish program?
To my knowledge, it is. It is.
So this is historic.
It is historic, and I'm so proud. It deserves many rounds of applause. And so I just want to thank you on behalf, let me start my comments by saying on behalf of all of GBH and GBH News, welcome into our space. This is the people's space. Make yourself at home. And I think we have many GBH fam who are here. Raise your hand. I want to thank all of the people on our team in the Boston Public Library who worked really hard with El Planeta and all of so many, a broad cast of characters to make this event possible. So I will say that I came here to Boston and to GBH News about a year ago, and I came here with really clear intentions on expanding the circle of who we do journalism for and with. The other thing I'll say is that I got my start in the in community newspapers, in the black press as a teenager, and so I saw from a very young age that Black and Latino stories have long been underrepresented and underreported. And take that a step further, Black and Latino voices have been underrepresented in mainstream media, especially when we are controlling the narrative editorially. And so I would say that this collaboration and on our side, and for me, is really an attempt to take a bite out of that disparity and add more levity and equity in the media space.
And Lee, do you have some data on the podcast?
Yes. So
can you share them?
the podcast is doing very well. We're very pleased. So clap, everybody, a big round of applause. So we're still in the run of the season. So how it typically works is after the last episode, we can get a more whole portrait of data. But we know that we have close to about 40,000 downloads of the series, which is really important and significant, on par with our biggest podcast with Boston Public Radio, Jim and Marjorie. We're not far behind the numbers for that project. And guess what, y'all? Most people are tuning into this podcast not through Apple, not through, name another platform. Spotify. But are finding us through Alexa. Over half of the people who are tuning into this project, is that you? How many people have found this podcast on Alexa? Raise your hand. Okay, we got a couple. And so that's really interesting, and that is something that we've never seen before. So after the last episode runs, we want to get back into that data and understand a little bit about what that means. We're really glad to be doing this, and encourage your friends, tell everyone to continue listening, continue downloading, and you have to also rank the podcast. If you're listening on Apple, take a moment to rank it, leave a comment, and tell the world how much you love it. We're excited to do this and more.
Yes. I also want to thank my team, my producer who is here. She just arrived in Boston, and Claudia. We have also Carla, Francisco. Thank you so much for all your help and for joining this project. And of course, I want to thank all of you for listening every Saturday, and hopefully we'll do another season.
Yes?
Yes. You heard it here, yes.
So we, on behalf of El Planeta, I really have to thank everybody here in this table. Harvard Medical School, since the newsletter of Salud, has been very supportive on the content. You know what is difficult? To curate the dense medical information into a more appealing content. I think the most talented person that have achieved that is Tibisay, have her managing this important topic instead of others is a luxury for the community. And also everybody involved. I'm seeing Dr. Caballero here, who was one of the guests in the podcast. I have known his leadership in the Latino community for many years. I know you're so happy as well to see this coming to a reality. And it's a lot of leadership. I need to remember as well one person who's not here. He's still alive in New Jersey. I hope he listened to this once. Jerry Villacres is his name. He was one of the founders of editorial committee in El Planeta a long time ago, 20-something years ago. And I remember he saying, I have a dream of having a Spanish programming, at least one show in GBH. I'm talking about many years ago. I hope he listened to this. Thanks to him.
Thank you so much. Let's eat arepas.
Yes.
Thank you.
Thank you.
Thank you.
Thank you.
All right, so we can take this.